Dr. Anuj Bishnoi from Civil Hospital, Gurgaon, and I hope you are doing fine at the time of COVID-19. Being a novel medical issue, there are several speculative reports regarding its connection with diabetes. And many of you are with diabetes are worried that the people who are with diabetes and they are having coronavirus or they are susceptible for coronavirus infection. So they are very susceptible to it. I am hereby today being a specialist in this regard, like to discuss about the steps that all diabetes should follow to keep their blood sugar levels and health in check during the current scenario. First and foremost, it is true that people with diabetes and other comorbid conditions like asthma, heart failure, raised serum creatinine levels, and those who smoke cigarettes and above 65 years of age are at higher risk. So these people should take more care about themselves, because we should not be so afraid of this coronavirus infection, as it is seen that in Southeast Asian countries, the mortality is very less as compared to the European or the American countries. And when you see about the mortality, it's more in the comorbid group. Comorbid means those who have already are having a heart attack, those patients with recurrent cardiac failure, those patients who are not controlling their blood pressure, those patients whose diabetes is not controlled. So they should take more care about themselves. And it is also true that this virus is affecting people who have already lung infection. For example, who are already having, who have already suffered from tuberculosis, or there are people who are suffering from COPD and other interstitial lung diseases. As we all know that all people in India and Southeast Asian countries, they are vaccinated by the government. And as per the government program, it is ensured that 100% of the newborn babies are immunized against certain diseases. So BCG vaccination, many of us have received. I think that 100% should be correct to say. BCG is against tuberculosis, but it is seen that during last few decades, the complicated tuberculosis, for example, meningeal tuberculosis, tuberculosis osteomyelitis, or tuberculosis spinal column disease, they have decreased a lot. Now, the tuberculosis which is presented in the community is only by lung or by lymph nodes, and they are treatable. So this makes us very much resistant to the coronavirus infection, as it affects the lungs mainly. In the later conditions, it may affect the kidney, or it may, or in severe condition, it may cause multi-organ failure. But it is assured that due to the vaccination program followed by the government for the last many years, has made your lungs very strong. And now if we talk about the diabetes, so stress, anxiety at this juncture may affect your blood sugar levels. Maintaining diabetes in control is beneficial to your immune system also. So a patient with diabetes in this at this time of COVID-19 should check his or her blood sugar very regularly. Everybody who is suffering from high blood sugar should have a reliable blood glucose monitor at home, and he should be able to check the blood sugar levels both fasting and after meals. The meals should be taken on time, and please avoid taking high calorie snacks. If you are with your family in these days, regular snacking is a common feature nowadays because you are with your family. So it is very good to avoid high calorie food, salt for a diabetic patient. Instead, vegetables like cucumber, fruits, apple, oranges, they are good at this time. Or yogurt also can be taken. And if you feel hungry in mid morning or evening between meals, avoid taking caffeinated soft drinks. Try to drink lukewarm water as much as possible. And please don't miss out on physical exercise. The gym and morning walks are halted during this lockdown, but it is important to find some physical activity for yourself. It does not mean that you have to do very strenuous exercises. Regular exercise like stretching or jogging at a single place for half an hour is good for your health. Make it a habit. Uh, make it a habit to exercise 30 minutes during your daily schedule. And just like your make your schedule for eating, working, exercise, it is also important to have a regular sleep. And regular sleep for 6 to 9 hours is sufficient. And avoid watching late night news on a mobile, laptop, TV, because it reduces your exposure to blue light on the retina, which disrupts your sleep. Take a break from the news cycle. Don't get disturbed by the news that so many deaths have taken place or the epidemic is spreading. Learn to live with the disease. After 4 to 6 months, you will see sporadic cases like this person is having COVID-19 infection, this person is having COVID-19 infection. For example, we are having a tuberculosis patient in between us, but we are not very afraid of them. We say that this patient is suffering from tuberculosis, taking drugs. Okay, he will become well after the course is over. So just don't panic if you see a COVID-19 patient or if you see the news. Just follow a positive frame of mind and a healthy lifestyle. Remember, stay at home, stay safe, stay healthy. Thank you.